Hi, I'm Dr. Robert Peppercorn. I'm a board-certified dermatologist. I'm pleased to work with you on SkyMD. We do work in all areas of dermatology, focus of course on telemedicine. I grew up in South Florida and used my education to see much of the United States, going to Harvard College in Boston, Johns Hopkins Medical School in Baltimore, Maryland, studied internal medicine at the University of Utah in Salt Lake City, Utah, and then finally did my dermatology residency specialty training at Stanford University Medical School in Palo Alto, California. After finishing residency, I left the big city and decided to come to a more rural area, population in the 200,000, and opened up a small practice that grew over the years to 4 offices and 40 employees, and it's been quite an adventure. So what I'm focusing on today is telemedicine, and with telemedicine, with SkyMD, we can do a great deal of things online. We can treat all acne, we can treat rashes, I can help you identify skin growths to determine if something more needs to be done. We can work on hair loss for men and women. We can give you advice on treating warts, common warts, private area warts, all kinds of things that you can think of in telemedicine dermatology. There's not much that you can't ask me about that I haven't experienced as a dermatologist for more than 30 years. When I was growing up in Florida, my father happened to be a dermatologist, and that led me into the interest in medicine. But it wasn't until medical school and then doing rotations in specialties that I developed the interest in dermatology. Dermatology was fascinating because I can use my eyes to make diagnoses without having to do a lot of expensive and fancy testing. So the unique aspect of a board-certified dermatologist is when a patient comes in, we can look at a problem and pretty much diagnose it based on our experience and our ability to view the appearance of a condition to come up with a diagnosis. One of the advantages of SkyMD is that we can do telemedicine 24 hours a day. We don't have to be live and talking to each other directly with SkyMD. What you can do whenever you have the opportunity, you can join in, request a virtual visit, and then upload some good quality digital images of the skin condition. We'd like to see a close-up image which is focused very well, and then one further back so that we can see where the problem is in relation to other body areas. Having a good picture is very important for us so that we can do a proper diagnosis, and you can upload really as many pictures as you'd like so that we can really get a clear picture about what's going on. We also like to have really good historical information. That could include treatments you've used before, medications you've used before, whether they were prescription drugs or not prescription drugs, what favorite skincare products you use. We'd like to know that because we'll give you advice on the best things to use for your condition. And it's good to tell us what you used that didn't work so that we don't redo that again. Once we have all of this information, our team will then forward that to the individual doctor to work on the case, and we get right back to you. Then you will also have the opportunity to ask questions in the chat section of these virtual visits. And then we will send prescriptions directly to your preferred pharmacy using an online pharmacy prescribing system built into our software. There are occasional conditions that may require a live video visit, and in that case we'll let you know, and we would schedule it at a mutually convenient time for us. One of the main things that motivates me to do this work after all of the years I've been involved in dermatology is that I want to help people get better. I want them to be satisfied. I want them to be sure that we met their expectations. So I welcome patients writing to me with an additional question now and then, just to make sure that we get all of your needs taken care of. Sometimes we may need to start another virtual visit to do more, but we'll let you know and we'll be in great touch. We have a great team of medical assistants. I call them our SkyMD medical assistant team, and they work with all of the doctors so that we can help get things going with prescriptions and authorizations, and whatever is needed, they're there to help, and we all work together as a team. So I look forward to working with you.